April 24th, 1984. Margaret Heckler, U.S. Secretary of Health and Human Services, makes a landmark announcement.
The probable cause of AIDS has been found. We now have a blood test, which we hope can be widely available within about 6 months.
Research scientists had identified the virus which led to AIDS, an epidemic ravaging the country and especially the gay community. 3 years earlier, a group of patients in Los Angeles and New York, most of them homosexuals, were reported to be suffering from a parasitic pneumonia. The gay liberation movement struggled to deflect public perception that a pleasure-seeking gay lifestyle was to blame for this fatal illness. In 1982, the Centers for Disease Control named the disease AIDS, acquired immunodeficiency syndrome, a condition occurring when the body's immune system comes under attack and leaves a patient vulnerable to infection. The CDC tracked an unsettling increase in the incidence of AIDS in the U.S. and Europe, and new reports of victims in Africa and other third world nations. Cases among heterosexuals, hemophiliacs, and intravenous drug users began to surface, and researchers deduced that a virus transmitted through blood products might explain the rapid spread of AIDS. The public responded with wariness, fueled by misinformation. Many believed they could contract AIDS by a handshake or other casual contact. Dr. Robert Gallo of the National Cancer Institute began to investigate AIDS, and drawing on crucial findings from the Pasteur Institute in Paris, he identified the culprit virus in 1984, HIV, human immunodeficiency virus. An antibody blood test became available a year later. Doctors warned that HIV could be transmitted through semen as well as blood, and agencies launched aggressive campaigns targeted to youth to practice safe sex. In October 1988, activists spread quilts across the United States Capitol Mall, displaying the names of AIDS victims. New drugs like AZT helped slow down the virus once it took hold, but they did not repel it. By the mid-1990s, sources estimated 20 million people worldwide were infected with HIV. Though the cause was named on that day in 1984, a cure is yet to be found. AIDS remains the greatest plague of the 20th century.